It's Dr. Christine Arseneau here, otherwise known as Tina, my nickname, and I am located in beautiful St. Augustine, Florida. I love animals. We have lots of animals surrounding us. You might hear some background noises. We have chickens and turkeys and peacocks, a duck, a parrot over there, a couple injured chickens in the bathroom, and 2 new puppies and a rabbit. So there's a lot of commotion going on here sometimes. And I'm also the founder and CEO of a company called Lyme Support, where we help people who have Lyme disease and autoimmune issues. And I just wanted to pop on and introduce myself because I know I have some new subscribers. You may not know why I do what I do. And so I used to work in the pharmacy. I've been a pharmacist for about 15 years now. And I had my own journey with Lyme disease. And I wasn't diagnosed for 20 years. And then I went on this long 4-year journey of getting well. And there was a lot of ups and downs on the journey. It was really frustrating at times. I felt really alone at times. But I got through the other end. I made it to a place where I'm fully well. I've been fully well for about 5 years now. And I learned a lot of things along the way. And I also had to unlearn a lot of things that I learned in pharmacy school. Because what I learned is that it's not just the physical body when it comes to our health, when it comes to our healing, when it comes to our well-being. It's not just about toxins in our environment or the physical things or taking medications, but it's about the mindset as well, and your emotions and your spiritual journey and all of these other things. And once I knew what I knew about healing, it was like I just couldn't be a pharmacist anymore. I couldn't just dispense medications for symptoms, which usually just mask the symptoms and don't actually ultimately help the patient. Now, don't get me wrong, there are medications that are life-saving and that really help people with their symptoms. But a lot of times people end up being on this cascade of medications because they need other meds for the side effects of this med, and it just becomes this big mess. So my focus when I work with people is reducing medications if we can, simplifying life, looking at effective lifestyle changes. I come from an ancestral approach where I realize how our modern life really causes inflammation. So if we can do things in a simpler way, we can get on top of that inflammation, we can bring it down. So we look at diet and stress management and all the things. And we also look at effective supplements that are more natural, that are going to work better with your body than a pharmaceutical, which your body is going to want to process and get rid of because it sees it as a toxin. And then I also look at not only the mindset, but the subconscious blocks. So the mindset piece is important because if you have a fixed mindset instead of a growth mindset, you're probably not going to grow along your journey and be able to really reach that recovery that I like to see people reach. So the mindset part can definitely block you, but it's that subconscious piece that really makes up 90% of your life. So if we can get that subconscious mind opened up and remove blocks and obstacles that are holding you back and keeping you from healing, then we can really shift symptoms in a bigger way. So really passionate about using hypnosis with my clients as well. So the other thing that I do, in addition to my coaching programs using my empowered healing approach, is I refer people to hospitals. So if they're just not a good fit for coaching right now and they need to go to a hospital to get a physical protocol done, there's a couple hospitals that I'm affiliated with overseas that use whole body hyperthermia. And they have effective protocols for Lyme and as well as cancer and some other things. So I have different options. I'm well connected in my network. So usually if I'm not a good fit to work with somebody, I can refer them to somebody who definitely can help them. So if there's any way that I can support you, feel free to send me a message. I'll link my email below or comment below and we can chat about what that would look like. And I would love to hear why you do what you do. I know a lot of you are passionate about your careers, so I would love to hear what you do and why. I hope you have a wonderful evening.